Welcome to this YouTube channel. In this video we are going to talk about what's coronavirus. How can we will be safe? Precautions treatments complete guide. So before starting this video, like this video, and subscribe to this channel for future updates. What is coronavirus? Coronaviruses are a type of virus that can infect humans and cause respiratory disease. The multiple crown-like spikes on the surface of the virus give it the name corona. Coronaviruses that cause sickness in humans include SARS, Middle East respiratory disease, MERS, and the common cold. COVID-19, a novel coronavirus strain, was initially discovered in Wuhan, China in December 2019. Since then, the virus has spread to every continent, except Antarctica. How can we will be safe? In the first half of 2021, millions of people in the Western Pacific region will celebrate significant religious and cultural occasions such as Lunar New Year, Tet, spring festivals, Easter, Ramadan and Eid al-Fitr, Wesak or Buddha Day and Songkran. Some religious and other celebrations have been toned back, postponed, or cancelled to prevent the spread of SARS-CoV-2, the virus that causes the coronavirus sickness 2019, COVID-19. COVID-19 cases continue to be reported at a rate of roughly 10,000 per day across the region's countries and territories. Even in areas where vaccines have begun to be distributed, doctors emphasize that individuals must continue to practice the 6 protective behaviors in order to halt the virus's spread. Clean hands, frequently keep at least 1 meter apart, limit time in enclosed or crowded settings, clean frequently touched objects and surfaces, and respond properly if suffering COVID-19-like symptoms. Given the importance of religious and other events, WHO has issued a number of advice materials and tools and is collaborating with authorities and faith-based groups in countries throughout the region to help keep people safe and manage risks. Providing protection to those who are vulnerable during celebrations, short movies describing the science underpinning guidance for people wanting to safeguard themselves and others during special events are part of whose support. During the holiday season, we tend to gather in larger groups, go shopping, go into crowded places and spend time together with friends and extended family, which increases the risks of this virus spreading, says WHO Chief Scientist Dr. Soumya Swaminathan in a practical 5-minute video, as part of the Science in 5 series. Maintaining the 6 protective behaviors is especially crucial when it comes to protecting family and friends who may be more vulnerable to extreme situations. COVID-19 affects a wide range of people, including the elderly, those with underlying illnesses, cancer patients and obese people, according to her. This could entail only celebrating with family members who already live together, and avoiding mixed household events. Gatherings in the open air are safer. People must remember to keep a safe distance, wash their hands and wear masks. Anyone who has symptoms like a cough or a fever should stay at home. Collaborating with religious leaders. Religious and spiritual leaders, according to WHO, are a vital source of support, comfort, and guidance in their communities. They can save lives by encouraging healthy habits and providing direction during times of uncertainty. The WHO Regional Office for the Western Pacific has released tip sheets for faith leaders on how to apply the 6 protective behaviors as a means of assisting them. Other advice focuses on keeping people safe at religious events with large crowds. WHO has given interim recommendations to help Muslims safely enjoy Ramadan and Eid al-Fitr, and the WHO Regional Office for the Western Pacific has released a series of posters and social media tiles with the theme Ramadan at home. Adapting to the new normal. The World Health Organization collaborates with partners to modify festivals. In Malaysia, for example, WHO collaborated with the Malaysian Consultative Council of Buddhism, Christianity, Hinduism, Sikhism, and Taoism to adopt Wesak Day, which honors the birth, enlightenment and death of Buddha. People used to gather to temples early in the morning to meditate and pray, line up to wash a Buddha statue and participate in a night procession of adorned floats flanked by people carrying flowers and candles. In the context of COVID-19, WHO and the Council collaborated to adapt whose practical considerations and recommendations for religious leaders and faith-based communities, resulting in a series of 6 simple, positive ideas depicting small family groups worshipping and safe temple-based activities. Seeing how Wesak Day was celebrated in a non-traditional but still special way gives me optimism that we can adjust to a safe new normal, said Dr. Lo Ying Ru, WHO representative to Malaysia, Brunei Darussalam and Singapore. I feel that good communication and a willingness to try new things were crucial to making Wesak Day as colorful and significant as it has always been. More information can be found here. Traveling in more safety. Because no trip is without risk, the World Health Organization, WHO, has issued a variety of travel recommendations and guidance for travelers and national governments. If someone needs to travel, the 6 protective behaviors of physical separation in the mode of transportation, opening windows, if feasible wearing a mask at all times, using disinfectant, or washing hands often with soap and water might help lower risks. Dr. Swaminathan advises anyone who is ill to postpone the trip. When staying in hotels or other accommodations, the 6 protective behaviors should be followed. The WHO also offers suggestions for hotel employees. If your travel plans include meeting persons who are particularly vulnerable, Dr. Swaminathan recommends quarantining for 14 days before meeting them. Traveling internationally adds an extra layer of danger. WHO is collaborating with national authorities to find local risk reduction strategies. In the Lao People's Democratic Republic, for example, WHO is collaborating with the Department of Communicable Disease Control, the Department of Civil Aviation, the Department of Immigration, the airport operator, and other partners to protect international travelers and frontline workers and prevent the spread of the coronavirus. WHO recently released interim guidance titled Considerations for Implementing a Risk-Based Approach to International Travel in the Context of COVID-19, which aims to provide countries with a risk-based decision-making process for calibrating travel-related risk mitigation measures in the context of international travel, with the goal of reducing travel-related exportation, importation and onward movement. Furthermore, the WHO Regional Office has produced guides for opening borders for international travel with the goal of keeping countries prepared for possible importations and increases in the number of cases, putting systems in place to mitigate potential outbreaks, and encouraging information sharing for joint decision-making, considerations to relax border restrictions in the Western Pacific region. Vaccines will aid in the control of COVID-19, but people must continue to practice the 6 protective behaviors when traveling, praying, celebrating or going about their regular lives. In the Asia-Pacific area, individual and community behaviors are still the most powerful weapon against the epidemic. COVID-19 transmission and protective measures. COVID-19 spreads primarily from person to person. Fighting this disease is our joint responsibility. Protect yourself and others by making these 6 simple precautions your new habits. Clean your hands often, cough or sneeze in your bent elbow, not your hands. Avoid touching your eyes, nose and mouth. Limit social gatherings and time spent in crowded places. Avoid close contact with someone who is sick. Clean and disinfect frequently touched objects and surfaces. Treatments. The most common symptoms of COVID-19 are a fever, coughing and breathing problems. Unless you have severe symptoms, you can most likely treat them at home, the way you would for a cold or the flu. Most people recover from COVID-19 without the need for hospital care. Call your doctor to ask about whether you should stay home or get medical care in person. Scientists are trying to make new medicines and test some existing drugs to see whether they can treat COVID-19. In the meantime, there are a number of things that can relieve symptoms both at home and at the hospital. At-home coronavirus treatment. If your symptoms are mild enough that you can recover at home, you should rest. It can make you feel better and may speed your recovery. Stay home, don't go to work, school or public places. Drink fluids, you lose more water when you're sick. Dehydration can make symptoms worse and cause other health problems. Monitor if your symptoms get worse, call your doctor right away. Don't go to their office without calling first. They might tell you to stay home, or they may need to take extra steps to protect staff and other patients. Ask your doctor about over-the-counter medicines that may help, like acetaminophen, to lower your fever. The most important thing to do is to avoid infecting other people, especially those who are over 65 or who have other health problems. That means try to stay in one place in your home. Use a separate bedroom and bathroom if you can. Tell others you're sick so they keep their distance. Cover your coughs and sneezes with a tissue or your elbow. Wear a mask over your nose and mouth if you can. Wash regularly, especially your hands. Don't share dishes, cups, eating utensils, towels or bedding with anyone else. Clean and disinfect common surfaces like doorknobs, counters and tabletops. What do you think of our list? Let us know in the comment section below. If you enjoyed this video and want more videos from us again, be sure to hit that subscribe button before you go.